morning, everybody.
Good morning.
Welcome to our first webinar of the autumn. Hope you've all enjoyed a good summer.
Autumn.
Yeah, it's a bit frightening, isn't it, really? Going to be jingle bells before we know it now. So, welcome to our webinar. The subject is tilt in space, back angle recline, and leg rest elevation. Just in case we've not met before, my name is Les Jones, and I'm joined by my colleague Rebecca.
Morning.
Rebecca's our clinical lead. I'll just leave Rebecca wander across to get ready for her part of the presentation. As always, housekeeping, we are recording the session, so if you could leave your mics and speakers switched off. There will be a link to download a copy of the presentation at the end as well. My colleague Kiwi will be in the background monitoring chat, so if you have any questions, whether they be technical or related to the content of the presentation, please post something on them. Hopefully we'll cover it towards the end of the presentation. So I'll pass you on to Rebecca, and I shall see you in about 30 minutes, 40 minutes. Thank you.
Thank you, Les. Get this up on the screen. Brilliant. Okay, so welcome. Thank you for joining us today. We've had a few months off now, so kind of just getting back into the swings of all the technical stuff, but hopefully this will run smoothly. And as Les said, Kiwi's there in the chat function to support us. So any questions, queries, issues, then please do use that. So thank you for joining us for this month's webinar. Today we will be highlighting 3 essential features of specialist seating. As Les said, tilt in space, back angle recline, and leg rest elevation. We thought it important to focus on these features because they can actually be overlooked and even underestimated with regard to their impact on the individual sitting in the chair. Hopefully by the end of the session, you'll have a sound understanding of the clinical rationale for tilt in space, back angle recline, and leg rest elevation. You'll be able to recognise when each feature is indicated, but then also how to use it safely, whether that's individually or in combination, with the aim of avoiding common pitfalls like pain, shear, friction, and compromised stability. And hopefully you will appreciate how these functions support comfort, pressure care, physiological health, energy management, and even engagement. Let's go back to the basics of seating provision so that we can fully appreciate tilt, recline, and elevation and their role within postural care. First, we must understand the individual, their support network, their environment, and ultimately daily life. We can only do this through a robust assessment process. We need to understand the postural challenges and define those seating objectives. Following that assessment process, we can then begin to consider and trial appropriate seating solutions that make up that chair prescription. Selecting correct and timely solutions ensures that the chair's features, like the ones we're covering today, match the user's postural and functional requirements. Next, as the seating provider, we must appreciate the correct utilisation of those functions and accessories and know the risks that are involved. The safe use of functions can help achieve positive postural outcomes, while inappropriate use will actually lead to further complications and, sadly, serious avoidable harm. And lastly, all involved in that process then need to support and clear guidance to be able to implement that provision as part of a 24-hour personalised care plan. And together, all these elements will support long-term postural health and overall well-being. So let's look at each step in a bit more detail. Now, the seating assessment is, of course, a wider topic than we have capacity to cover during this limited time together this morning. However, it is important to clarify that the first step to effective seating provision is that comprehensive subjective and objective assessment. So in other words, information gathering and baseline findings. So for today, I guess in relation to postural adjustment, we will focus on basic chair dimensions, understanding postural stability, and the importance of establishing those critical angles for sitting. Now, every chair must be set up to fit its user, supporting posture appropriately and ensuring maximum contact with the support surface to distribute that weight evenly, whilst, of course, maintaining comfort and independence. It's critical that the seating prescription and the subsequent setup is based on the individual's body shape and size, which would, of course, be determined during that seating assessment. And if it's not, then it can cause more harm than good. The way in which the chair is set up does influence positioning and functional movement, which can consequently impact on the risk of secondary complications, including body distortion, pressure injuries, and reduced quality of life. When we talk about measuring for specialist seating, here are some of the key measurements we would look at and how we would reflect that within the setup. These are guidelines, as they would, of course, be affected by the person's size and their body shape. For example, a plus-size individual may need a longer seat depth than kind of what we've recorded here. The measurement range would be different, with the lumbar section adjusted to accommodate the gluteal shelf, or an individual with severe wind sweeping, that fixed deformity, who then may need a wider seat width, measuring from the hip on one side to the knee on the other side to accommodate and protect those lower limbs. Now, the reason why I'm going back to the basics on this is because we simply cannot implement any of the chair functions that we're focusing on today without first getting the setup right and to achieve that much needed postural stability. And it's worth saying as well that a big part of that chair setup is the transfers into the chair. Now, that's a whole other webinar, but just considering how somebody transfers and that initial positioning within the chair as well, obviously then dictates how they adopt those postures throughout their sitting period during that day. I want to spend some time reviewing two key dimensions with you, as it's a great opportunity to highlight the importance of basic chair dimensions in securing that individual in the chair and allowing them to use things like tilt, recline, or elevation without risk of discomfort, pressure issues, or instability. So, seat depth. A chair with the right seat depth ensures pelvic stability by supporting the pelvis posteriorly. Now, without that posterior support, the pelvis can tilt backwards and encourage sacral sitting with a posterior pelvic tilt, which I don't know if you'd agree is one of the most common presentations that we might see, just because of the effects of gravity and how it pulls someone down into that position, especially if then we have damage to the body systems, generalized weakness or tonal changes. If the seat depth is too long, then the individual simply won't be able to bend or flex their knees over the seat edge, so they'll slide forward to seek that support through the feet and to relieve pressure on the back of the knees. This increases shear and friction and increases the risk of falls and serious injury. If the seat depth is too shallow, the area over which the body weight is distributed, of course, will be reduced, which increases the risk of pressure injury too. Now, when we set the seat depth correctly, the individual's pelvis should be positioned at the back of the chair with an approximately 2-finger gap between the back of the knee and the front edge of the seat cushion. And this allows as well some space if we are then looking at elevation to accommodate, I guess, those pivot angles that are happening. Next, we have seat width. That's there really to laterally stabilise the pelvis, so stabilising from the sides. The correct seat width would reduce the tendency for the individual to shuffle the pelvis or lean, and we start seeing that pelvic rotation happening. Those are, of course, undesirable movements where we can then see things like obliquity and the posture becoming increasingly unstable with unequal loading on tissues. Now, left unmanaged, of course, that leaning posture could lead to development of things like a scoliosis because those asymmetries are exaggerated by gravity. Chairs with adjustable armrests as well, so it's worth mentioning different chairs have different features. So you can have chairs which we may be able to show you later, depending on the kind of Q&A that comes up, but adjustable armrests where there is Separate adjustments from front to back or left to right means that we can set different seat widths to support things like windsweeping or fixed lower limb postures, or even those with increased body mass in the gluteal and hip areas as well. The next focus for the assessment is postural stability and understanding how the person's presentation, such as their strength, their tone, or their movements, impact on their ability to remain safe and secure in the chair. Postural stability is achieved when the pelvis is secure at the back of the chair, as I've mentioned, but also the feet are fully supported, so we get that proprioceptive feedback as well. As already covered, the correct chair setup is imperative because we need to support those body segments with as much of the person as possible in contact with the chair. Now, management of pelvic instability will depend on whether the pelvis is fixed or whether it's correctable. But again, that's a whole other webinar. And the aim is to support the pelvis in all planes of movement. So that's why the assessment is the foundation, really, to understand cause and effect. We also need to consider how the critical angles for sitting and the correct use of chair functions impact postural stability, which we will look at next. By evaluating joint mobility and flexibility, particularly at the hips, the knees and the ankles, we can determine any limitations or asymmetries and understand the individual's achievable seated position, so what's realistic for them, and also the tolerance angles to make sure that we maintain that stability, comfort and functional alignment. Range of movement analysis is essential for understanding those critical angles required for optimal sitting posture because it affects the next step in the provision process, which is the selection of the appropriate equipment and seating solutions. Now, your seating assessor would need to know this information in advance to be able to select the correct solution, which is why we always emphasise that the postural assessment is different and comes before the seating assessment. So, for example, if knee range of movement is a concern, then the seating assessor would know to bring along a chair with a negative angle. So that really maximises the time that you have together trialling the chairs. Okay, so once we have measured the individual, we've ensured the correct setup, we've assessed their postural stability needs, and we've completed that range of movement analysis, essentially defining those postural challenges and agreeing on the seating objectives, because we do need to prioritise sometimes what's important and what we are hoping to achieve, what the individual is hoping to achieve. And that's that holistic approach. We can then start working with the seating assessor to look at these seating solutions, try them with the individual, always starting with the least restrictive options first. During this step of the process, the individual can decide how they feel about tilt. This may be the optimal least restrictive option for achieving things like pressure distribution. It may be the simplest way of achieving postural stability, and it may be the best way for that person to be able to rest and recuperate, reducing the amount of time that they spend in bed during the day. Choosing the appropriate solution also applies to knowing at what angle to set the back of the chair in relation to the seat. So that's the hip angle tolerance. And of course, there are going to be exceptions to what I'm about to say next. And those of you who do come to our webinars probably know what's coming. But as a general rule, especially when we're working with individuals with complex needs or those who do rely heavily on care packages, it is often more appropriate to set the back angle once and then ensure it's not adjusted again without clinical input. And that's due to the possibility of an incorrect readjustment, which will impact stability. It may increase the risk of shear and friction forces if the user presents with abnormal muscle tone, if they have involuntary movements like an extensor spasm or instability. What we can see are reflexes increasing as the hip angle is opened up. Therefore, where possible, please do consider utilising tilt in space as part of a daily routine, as you can achieve mostly all of the same postural outcomes without the added risk of someone sliding down the chair, falling, or developing a pressure injury. There are ways to set and lock the back angle as well if you are concerned about someone adjusting it incorrectly, and maybe that's something we can look at when we look at the chairs after this presentation. It's vital to understand how to make the most of the leg rest as well, to tailor it to the setup for the individual. It isn't just about elevation. I know we're focusing on that, but that tends to be the risky part of the leg rest. But it's also important to understand how we can support the lower limbs and how that impacts positioning as well, especially with people who maybe cannot achieve those critical angles for sitting. So let's look at these key functions in a bit more detail and understand their clinical indications. Tilt in space allows the whole seating system to be tilted while the seat to back angle remains the same. So therefore, it doesn't alter the user's hip and knee angles. We can refer to this as posture neutral, as it does not affect the critical angles for sitting, which is fantastic, because it means that we can maintain that stability that we've tried really hard to get during that assessment process. Tilt offers a level of adjustability that can reduce discomfort caused by long periods of sitting. So individuals with chronic pain, maybe joint issues or neurological involvement and impairments often benefit from this ability to change their position easily and safely to help manage pain without needing to leave the chair. It encourages pelvic stability by supporting the pelvis at the back of the chair and utilising gravity to secure it in place. This can also help to regulate spasticity and normalise movement patterns. Research has shown that if we have that proximal stability at our core, it helps with distal control, which is of course important for things like functional engagement. It can promote safety by reducing then that risk of sliding down and falls from the chair. It can assist with head control and opening up the shoulder girdle by using the effects of gravity again to help things like physiological processes, swallow function, respiration, and even bowel and bladder function. Obviously, there are going to be cases which we will cover shortly when we talk about safe use. There are things we need to consider in terms of precautions and contraindications here, though. Tilt can support energy management strategies because it brings the user into a resting position for a period of time, which allows them to recuperate before returning upright again to continue with the activities that are important to them. Supporting that midline alignment can help manage fatigue because it allows the body segments to work together efficiently, which enables then functional engagement in daily life through improved alertness and energy. We can use tilt in space to help with independence as well. So things like transfers and positioning, again, by utilising gravity to bring the pelvis down into the back of the chair. In turn, reducing the effort that's needed by the user, but also the support network as well. That can help to reduce dependency and in turn boost confidence. So then we get that motivation to actually engage in their care as well. It's worth mentioning that some chairs can offer a forward tilt for users who are able to stand but maybe just require a bit of assistance, and that can be incorporated into their rehab programs. All these positive impacts can ultimately improve sitting tolerance and compliance with equipment, because that's how we achieve our clinical objectives. Now, pressure injuries are a serious risk, as we know, for those with limited mobility or those who sit for prolonged periods of time. And this is shocking when we think, that 98% of them are entirely avoidable. Repositioning an individual against the forces of gravity in different degrees of tilt can redistribute pressure away from vulnerable areas and ultimately reduce the risk of skin breakdown. It allows regular weight shifts without requiring physical repositioning by the caregivers, again, supporting all involved. However, please don't forget that the key intervention for prevention is regular positioning. It's not just about setting this one tilt angle, but how that's adjusted throughout the day and how that's reflected with clear guidance in their care plan. So regardless of the angles that may be indicated, this is of no benefit for the user if they're not regularly moved through different ranges. Now, just a bit about the research that's out there. Small tilts up to 15 degrees can be used to start adjusting pressure distribution through the back. Moderate angles are going up to 20 degrees of tilt. So this was a systematic review that concluded that can effectively reduce interface pressures under the pelvis. Tilt into 20 degrees resulted in an 11% reduction in interface pressures. And then we move up to larger angles, so increasing above 25 degrees can result in doubling that reduction of interface pressures to 22% over the ischial tuberosities, which we know are kind of this vulnerable area, just because of the position and how they're positioned within the chair. Of course, that can be affected by somebody's tilt as well. So if somebody's sacral sitting, the sacrum would be our concern then. And that's why it's really important to ask about these things during that history taking, a history of pressure injuries, knowing how somebody, what their habitual postures are like and where those vulnerable areas may be for that individual. Remember that pressure force is not the only factor to be mindful of with regard to pressure injury risk. So pressure also is defined as this localized damage to skin and or the underlying tissues because of pressure, which we've mentioned, or pressure in combination with shear. So pressure relief maneuvers, such as, seated push-ups, lateral leaning, forward leaning, they can only be performed by individuals who have sufficient physical strength and coordination to be able to do that. So if you work with individuals who are not able to independently reposition, seating systems with tilt and recline, as long as that's appropriate, can actually offer the ability to redistribute weight and reduce those sitting pressures, following, of course, a comprehensive assessment and an assessment of their risk as well. Now, research has shown that a 15 to 25 degree tilt combined with 120 degrees of recline provides both muscle and skin perfusion at the ischial tuberosities. So utilising tilt in space before back angle recline, it's just important really that we do that tilt first to utilise gravity before back angle recline to reduce that shear and friction that we might see with only using back angle recline. When I mentioned about shear as well, in cases where the shear may be the biggest concern, a combination of 110 degrees recline and a 10-degree angle of the tilt can help to help in the gluteal region when sitting. And further, data suggests that increasing the tilt to 25 degrees can actually eliminate those shear forces. Now, in real life, because I do like to make things accessible, because there's obviously gold standard, but we have to be realistic in what's achievable within daily life to make sure we get that consistency. Despite this assumed scientific ideal, individuals who do have tilt in space and do have these functions tend to actually prefer and use small and medium angles more than large angles. And they spend the greatest amount of time in tilt angles less than 20 degrees. The fact that smaller angles are utilised more implies that people tend to lean on tilt in space maybe for comfort and stability and functionality rather than pure pressure management. But of course, we have to define those objectives and understand what we're actually trying to achieve, what's the greatest risk. So while higher tilt angles can offer more pressure distribution for those at greatest risk, angles between 20 and 35 can provide this balanced approach, ensuring both comfort, functionality and pressure care. Tilting beyond 35 degrees can, of course, negatively impact the functional use of the chair, making it harder for the individual to engage with the environment and perform daily tasks, and expecting individuals really to spend a lot of time in such a non-functional position for long durations is unrealistic and may impact their tolerance as well of the chair and the compliance with the piece of equipment. So considering the difficulty that users have incorporating in larger angles of tilt and recline into daily lives and the impact that this can have on function. It's sometimes good to consider performing small angle changes but continually throughout the day, as that's probably more widely accepted and an effective way of achieving that regular change of position, which we know is key to reducing the risk of pressure. So I mentioned back angle recline. This differs to tilt in space because it does actually adjust the seat to back angle. So we do affect the user's hip angle within the chair. And of course, this has its implications, which we'll cover shortly. Back angle recline, of course, does have an important role to play, but we have to really respect the impact it can have. I mean, positives, it can promote comfort and relaxation and energy management. It can open up the hip angle for individuals who maybe experience pain or discomfort, maybe things like hip subluxations and dislocations. Maybe they have reduced range of movement, so we do need to set the back angle to accommodate that. For individuals, so plus size individuals, it can help to reduce abdominal pressure. If somebody has pronounced abdomen, maybe there's some medical diagnosis there, it can open up the hip angle to relieve that pressure for comfort. It can also help to relieve hamstring tension, especially if we're elevating the leg rest for some individuals, if that's appropriate. As with recline, lower limb support, of course, has a significant role to play as well in supporting that body segment and in turn promoting that stability of the pelvis. However, again, we have to be mindful of how it's utilised day to day. Leg rests are designed to provide comfort and support. It can help reduce strain on the lower body by promoting proper posture. It can improve things like blood circulation, making them essential addition for those who need the ergonomic benefits. So research has shown that raising the legs above hip level for 30 minutes, 3 to 4 times a day may help improve swelling. So things like edema and encourage that circulation, which of course can help manage pain. We can, in combination with things like tilt in space as well, we can start using that combination to raise the lower legs higher than the hips, so getting the legs higher than the pelvis, because that might be more comfortable than just elevating the legs with the knees fully extended. And as mentioned, it's also important to encourage comfort and lower limb alignment to get that proprioceptive feedback at the feet. So the foot plate is an important part of that leg rest. It can help with the critical angles for sit-in. So I mentioned negative angle supports. This may be indicated to accommodate limited knee range of movement, allowing a more comfortable sitting position for users with tight or shortened hamstring muscles. It can also facilitate safer standing by allowing optimum foot placement, under, so we kind of get in the nose over the toes to help with that sit to stand process and getting those feet stable on the floor. It can help with lower limb alignment as well. Sometimes something like a tailored solution, like a W trough leg support, can support that alignment, especially for individuals who have that frog legging, it's a technical term, where we get that splaying, or even the wind sweeping, where it is correctable to bring them back to that midline. Again, assessment is important to understand what we can fix, what's fixed, or what we can correct. Now, it's important, I know we're kind of focusing on leg rest elevation, but as an advocate of postural care, I think it's important to raise how important the foot support is. As a load-bearing body segment, the feet can be forgotten about in sitting, but they are a crucial part of that seating provision. So insufficient foot support, if you're going into environments where the foot plate is being lost, it's being used as a doorstop, if the seat height is incorrect and feet are dangling, that can have a really negative impact on somebody's postural stability. And we can start seeing significant postural challenges developing just because the feet aren't supported and we're not getting that proprioceptive feedback. Even in sitting, almost 20% of our body weight goes through our feet. So if we don't support the feet, where does that 20% go? We could have, 94% of our body weight just going through our buttocks and thighs, and then we're wondering why pressure injuries are happening. You may need to consider, when we talk about the leg rest and the foot support, you may need to consider adjusting, making sure you have a height adjustable foot plate, angle adjustable foot plate, so that we can really fully support that body segment and reduce the gaps that we may see when we're supporting the lower legs. Okay, so the next step in that seating provision, we've done the seating assessment. It's all good and well knowing that we need things like tilt potentially, or back angle recline, or leg rest elevation. But the next step is making sure that on a daily basis, everyone involved knows how to use them safely. As clinicians, we obviously can't be there 24/7. At some point, our input ends. So we have to make sure that everyone involved has the competencies to understand that. If we don't fully understand the implications, or if the service user, the individual or the support network or the caregivers don't fully understand the implications of things like recline and elevate, it could negate all our hard work that we've done during the assessment process and actually put an individual at risk of serious harm. So let's have a look at how we do that. So tilt and space, I give you a whole list of things of positive outcomes that we can achieve with tilt and space, but there are going to be specific cases where we need to be mindful and we need to fully risk assess and closely monitor the use of tilt and space. So, for example, those with dysphagia, so those with swallowing difficulties, and again, you may need to rely on speech and language therapy colleagues to support you with that and to understand, what kind of tilt is safe. And reflecting that in the care plan. Maybe they can tolerate a 5-degree tilt or a 10-degree tilt to help with rest or pelvic stability, but then making it clear that they come up to a neutral 0 position for meal times, and how long after meal times do they have to stay in that position before any form of tilt is put in place. You need to be mindful of those with a history of respiratory distress, repeated infections. Maybe there's a history of silent aspirations, choking incidents. Again, being mindful of the head position, and of course a tilt can impact on that risk as well. I mean, there is a flip side to this, that we can utilize gravity to open up the shoulder girdle to help with breathing ability. So that's why that risk assessment is so important. There may be individuals who need the use of a tray for communication aids, PECS boards, for example. Maybe people have eye gaze systems, so we need to be mindful of how we calibrate that with things like tilt. And those with catheters as well, with extreme tilt, there can be a risk there of backflow, so just be mindful of that as well. When we talk about back angle recline, and a big part of this is that pelvic stability, making sure that we have that security within the chair before we even considering utilising back angle recline throughout the day. Because if we have this unmanaged postural instability and we use back angle recline, we can encourage that sacral sit-in. So we can start seeing sliding in the chair, sliding down the chair, increasing those shear and friction forces. It can affect the lateral support position as well, with gravity exaggerating asymmetries. We can see pain increasing, sadly pressure ulcers potentially coming, and it can also exacerbate abnormal movement patterns. So if you work with people who do have these abnormal movement patterns, extensor thrust, as I said, sometimes opening up a hip angle, we can see those tonal reflexes increase. And then we have safe use of leg rest elevation. Now, it should only be used within the ranges tolerated by the user, which is based on their knee range of movement. So that's why when we talk about assessment, that range of movement analysis is critical to understand what their hamstring's like. And we obviously need to do that with the hip flex as well, because the hamstring muscle goes over 2 joints. We need to make sure that we look at knee range of movement with the hip flexed to get an understanding of their tolerance for that elevation. Because if somebody doesn't have the knee range and somebody goes in and adjusts and elevates that leg rest, it's going to cause significant pain. It's going to pull them, and maybe you can demonstrate that shortly when we get the chairs out. You can pull people down the chair, slide in, risk of falling, and of course that shear and friction forces that we mentioned. So how we monitor this is that last final step, once we've decided on that prescription and hopefully got the funding for it, is making sure that when we leave, when that input ends, is to have some form of robust review process. Now, I know we all have different clinical practices coming from learning disabilities. We rarely discharge people, so we have that review process. It's a lot easier for us to do. We can have databases and review people regularly through postural management clinics and so on, and annual reviews. So I appreciate if you work maybe within the community, within social services, where it's a case by case and you discharge, you still need a robust plan in place so that the individual and the caregivers know when to seek support again. That will not only help them, but hopefully reduce the complexity and reduce the referrals and the intensity that you will need to give if they do come back into that service. So a big part is this personalised care plan. We've done a whole webinar just on personalised care plans, but just to really highlight thinking about a 24-hour timetable, how that chair is used with other equipment like nighttime positioning, understanding the risk factors and those indicators for review. So, of course, this is going to be holistic, making sure that the individual and the caregivers, because if we work with complex needs, we will rely heavily on the caregivers and the support network, so they need to understand that care plan as well and be compliant with it. So it's vital that we understand daily life for the individual and for them as well, and make it accessible for them. That care plan needs to be accessible and tailored to the comprehension and the cognitive ability of the person who will be following it, making that clear, concise, jargon-free, and involving them as well. There may be some competencies, some training needed as part of that as well. We do have templates available to just really support that and streamline that process for you. Big part of their care plan, as I said, is the safety aspect, making sure that all those risk factors are evident. So especially when we talk about safe use, if somebody doesn't have knee range, making it explicit that they shouldn't be elevating their leg rest. If somebody has speech and language input, and having that 24-hour timetable to know how much tilt is safe for them and for how long they can be tilted after meal times and so on. It may be contraindicated, in which case there are physical things we can do to the chair to lock that off that might be needed. But that strong process needs to be there as well for them to be able to seek support. Is there a change in behaviour? Have they suddenly developed red areas? Are they saying they're uncomfortable and not wanting to use the chair anymore? Has there been a new neurological event that will impact? Have they deteriorated? Have they lost weight? These are really important factors that would indicate the need for a review. So just make that clear on the care plan. So in summary then, it's, we really took this back to the basics, but it's important to understand how significant these features are when we talk about the impact it has on the individual. They're not just things that should be used just because they're there. They have a purpose and they need to be prescribed and they need to be monitored. So we need to make sure we have that robust assessment process that leads into the seating solutions, but then there's clear guidelines on how to utilise that day to day, so that we have that safe use for consistency. But it must not be overprescribed or unnecessary complex as well. So if somebody doesn't need back angle recline, maybe choose a chair that doesn't have back angle recline to reduce that risk if you're really concerned about particular multi-user environments. And then that holistic approach is fundamental to compliance, because the end line is, if the individual doesn't use the piece of equipment, we're not going to achieve our clinical objectives. Okay. We're back up on the screen. So probably the first point is to just demonstrate, I guess, in real life what tilting space.
I'm going to use the chair called the multi-adjusted advanced. I'm sure Kiwi will post a link up to this chair. I'm not going to spend a lot of time on its features and benefits. It's not a sales pitch. We just want you to get a visual perspective of the theory that Rebecca's just run through. Tilting space. The whole chair tilts. The back to seat angle remains constant. Before I start, though, I suppose I should kind of reinforce what Rebecca said as well, that the correct seat width, seat depth, and seat to foot plate or seat to floor height is critical as well. tilt in space. The operation of tilt in space, once you've got those correct, doesn't alter the effect.
Yeah, and if you are concerned about those adjustments, there is a QR code on the, on the new chairs that are going out that can give you kind of how-to videos
Just on the back
on
there.
adjustments.
Scan that. So all the chairs have seat width, seat depth, and seat foot adjustment. Just going to take that away. To go through that tilt in space action. And whenever I talk about tilt in space, I always forget to think about the effect of tilt in space tilting forward.
Yeah.
So if you have somebody who's semi-ambulant, this chair can be set up so that it'll tilt slightly forward. Foot plate can be elevated or retracted, and you can see I've got a negative angle on the leg rest. So that if I need to stand, get a nice good position to rise from the chair. So that's tilt in space. Back angle recline, again, it is what it says on the tin. It's the back moving in isolation to the seat surface. So I'm opening up the hip angle.
It's probably important to highlight actually here, those of you who, you may be working with individuals where you are prescribing rise and recline chairs. It's probably worth mentioning that obviously on specialist seating we can isolate that, but generally when you see it in rise and recline, you see the leg rest.
It's a linked mechanism, so
yeah.
It's going to be issues for somebody with, let's say, somebody who's got wrist, without the full range of movement of the knee, as they recline the chair, the leg rest elevates.
Yeah, so just be mindful of that. If you're working with individuals who do lack those critical angles, especially at the knees, something like a rise and recline chair, where there's that linked recline and elevate may not be suitable. Well, it won't be suitable for them because they'll just pull them into that sacral sitting. But this obviously is showing you how it's isolated, that back angle recline.
Yeah, so the three fundamental movements, leg rest elevation, tilt in space, and back angle recline, are all separately controlled.
And can be motorised as well.
And can be motorised as well, yeah. The leg rest, just on the side of the chair here, elevates. So we've got a negative angle as standard. Tall inclined, we can extend length. Also got angle adjustment.
And I think people forget, that foot plate is a key part of the leg rest. Getting that foot stability, getting that proprioceptive feedback is key to that postural stability.
So we've talked about all the advantages of tilt in space and back angle reclines. We also need to consider some of the cons, the contraindications. Those
who come to our webinars know, probably, we mention in nearly every webinar just about the safe use of back angle reclines. It's really good to have the opportunity today to go into real detail about that, to highlight it. So
I've got the chair set up with a waterfall back with adjustable laterals in the chair. So do you want to do that?
I could be more.
Yeah, that's just about. I'm just going to adjust these for Rebecca. Just want them just beneath the axilla. That's fine. So tilt in space, not a problem.
We're not changing the back angle, so the laterals stay exactly where they need to be to support the trunk.
Back angle recline, though, if you look at the position of the lateral alongside Rebecca, you'll see that gradually, I'm going to ask, but it's pretty evident, that's not going to be very comfortable. Because in effect, what's happening is that's the back of the chair. That's Rebecca. She slips down the chair. So when I bring Rebecca out of back angle recline.
And you'd imagine as well that if you need that trunk support, the repositioning would be difficult. And then say that's not where it was when I started. Ideally, you don't want somebody to be able to reposition, so it goes back to where it should be. But in real life, the type of individuals we work with, they're not going to have that ability to do that. So if you, again, just to highlight the type of individuals, if somebody is needing external lateral support, obviously as part of your assessment, you decide whether it's contoured, whether it's external laterals, whether you need multi-point support. If you've decided that external laterals is the best support, then again, back angle recline as daily use may not be the best option.
So let's look at leg rest elevation. I need to be careful when I elevate the leg rest. If you look at Rebecca's upper leg, there's less and less and less of the upper leg in contact with the seat surface, so detrimental effect of pressure care. But comfortable? Yeah,
it's not. You can start feeling it, you know, you feel the pressure then moving towards the sacrum.
So the only way that I turn you. Okay. So over time, the only way that Rebecca can sit in this chair then is to,
you know, you start getting yourself comfortable to be able to support that, you know, gravity, exaggerate those asymmetries. Then we start seeing these significant postural challenges happen just because the way that the chair is set up, not necessarily because of any damage to my body systems.
So with my magic wand, I'm going to get you to sit back in a nice posture. So to manage that leg elevation, what we do is we can just extend the leg rest.
So again, that might be a step within your care plan. You need to make very clear that if you are elevating the legs, that the foot plate height may need to be adjusted, because obviously we have different pivot points, so we need to be able to support that.
Plate as well.
While we're talking about the leg rest, and you know, I had the range then to be able to tolerate that elevation. If I didn't, so you know, that range movement analysis is critical, because if I don't have the knee range and leg rest elevation happens, we show leg rest elevation with knee contractures. So you know, this is all I could do. This is the only angle. So to be able to, that's the only angle I have. So to be able to stay safe is pull me down into that sacral sit-in.
Dragging you out of the chair.
Yeah. And then when we reposition, I'm suddenly forward in the chair and increasing that risk of falls.
So another useful tool that we use for those people who need extra consideration with the use of tilting space is what we call an inclinometer. So on the side of this chair here, we can put them on, not on any of the chairs. It's a tilting space gauge, so we can monitor what the angle is that somebody's sitting at. So coming back to the care plan, which you mentioned earlier.
Really prescriptive, can't we?
It can be prescriptive, exactly. Yeah. So, you know, lunch, we want to be upright, so 0. After lunch, we fatigue really quickly, but we don't want to go to sleep yet, so perhaps 10 degrees. Of an evening, we're going to just snooze a little bit, so perhaps 20 degrees. But we know possibly from history of working with the client or the patient that anything more than 20 degrees just exacerbates chest health and it's difficult in swallowing. So we can monitor and make sure that it's well documented that range of tilting space movement that we're going to use. Yeah,
and of course lean on colleagues and that might be a case of working jointly with speech and language therapy to really understand. You might be the first person that's picked up that there's a link between their posture and the history of respiratory illness. You know, maybe nobody ever put that link. I know whether they haven't actually ever been assessed for their swallow. So that might be something to just, you know, that's a powerful tool and it's a powerful position to be in to seek that support to help someone.
So I guess we could look at the use of tilting space and back angle recline in unison. So we may have a client who has a limited range of movement at the hip, can't achieve 90, not that many of us can achieve 90, so they need to sit with an open hip angle. So we could be compromising the stability of the pelvis. So I'm going to open up the hip angle.
And so you can see it's already tilted as well. First, tilt first, then open up the hip angle.
And I'm just going to use a little bit of gravity. So the way that I use gravity is just to tilt back. So it's going to counter that slipping effect. It's going to hold that person into the chair. Something that I do, I'd say on nearly 90% of the assessments I'm involved with back angle recline, is to set back angle recline at whatever angle is needed. Then we isolate or disconnect the mechanism on the back of the chair so that back angle recline can't be inadvertently changed.
Problem solving.
Yeah, it may sound like we're kind of anti-carer, but it's just trying to make things.
Yeah, when there's handles, it's easy to just press them and see.
Yeah.
I mean, the back angle recline always comes with a double lock anyway, so there should be some, you know, hesitation there.
They clearly labelled.
Labelled.
You know, a colleague of mine says, you know, you see carers at the back of the
Squeezing
chair as though they're on a push bike, and they squeeze both. When the tilt moves freely with the back angle recline, I spin that round, you can see there's a double lock. Put my hand there to give it a bit of perspective. So it's a double movement needed to open up the hip angle or the back angle recline. I need to unlock the lever, squeeze the lever, adjust, and you'll hear it click, lock when I come back to the to lock the angle in place.
So that's again an important part of our assessment process, and communicating with the seating assessor if you are concerned about recline or leg rest being inadvertently used when you leave, and then just mention it to the seating assessor and they can come up with a solution to be able to limit that. Hoisting as well, I mean, you saw what a good position that was in, just when it's tilted slightly, can really help with hoisting. So reducing the effort that's needed because you're using gravity instead of the person to be able to bring that pelvis right down into the back of the chair.
In the spirit of kind of the world that we live in at the moment, and we've got to reissue and refurbish and reuse equipment, I'm just going to mention the HydroTilt. The design of this chair is now 30 years old.
Yes, celebrating 30 years this year.
50th anniversary of CareFlex. This chair was the foundation, if you like, of where we are now. It's a tilt and space chair only.
That's when I said earlier, you know, if you don't need back angle recline, don't make it over complex, and you'll make it as easy as possible, and maybe go for a chair that actually hasn't got it.
Why overcomplicate?
Yeah.
What we can do, if you look into this, is coming back to this reissuing and refurbishing chairs, you can use seat ramps to alter the hip angle. So if you can see that there, everything seems to be black on my screen here, but you can see that there. And this would sit underneath the cushion to, in effect, close that hip angle, because the HydroTilt comes at 180 degrees as standard angle at the hip. If you are refurbishing a CareFlex chair, little tip for you, those of you who watch us regularly must be a little bit bored with this now, but I'm going to tell you anyway. Every CareFlex chair has a unique serial number. Can't quite see it. It's a silver label on the back of the chair. So if you have a chair that you're looking to reissue in your stock in your community loan store, or perhaps you have a chair that's not been used for a while in your care home, give us a call, quote the serial number. We can give you the exact specification of the chair. We can also give you an indication of how that chair can be used and how it can be adjusted to suit the needs of your client, your patient, your service user.
Yeah, I think so.
Hopefully that's covered most issues. Just checking my notes. I think we've covered most of the theory with a practical visual evidence of how to apply that.
Our main aim for this was to highlight that they aren't just, you know, features you can just choose on a whim. They're actually a key part of the prescription, and if they're not used appropriately, if we don't consider the impact that they have, they can actually cause more harm than good. So we just really wanted to take the time to highlight how important it is to reflect it in the care plan, day to day, how to use them safely when they may not be indicated, and the benefits, and maybe just thinking about, do I need back angle recline? You know, how do I make the most out of tilt and space, and even working collaboratively as well, and signposting if you need that support to come up with that. Yeah.
So just over to Kiwi, do we have any questions, Kiwi, on the chat?
Hiya, yeah, we do have a question. I've got, are the main seating points also the same for those living with obesity?
Say that again, sorry.
Are the main seating points mentioned also the same for those living with obesity?
The seating points as in the contraindications and...
I think so, that's all I've got. Hold on, I'll just ask.
Yeah. The seating point is in the actual physical where they sit in the chair, or sorry, just so I understand, so I don't answer the wrong question.
We do have a range of accessories and products specifically at those people with obesity.
Yeah.
For that kind of typically that gluteal shelf.
Yes, we've got the general clinical information you mentioned and assessment points.
In general, yes, but as I said, there are some certain extra considerations that will be needed, especially around the basic chair dimensions. When I said about seat depth, especially if there's a gluteal shelf, you know, if you have that extra tissue at the back, it can affect where the ischial tuberosities sit. So if, for example, if you are measuring an individual, you know, and we just go in from the back of the pelvis to the back of the knee, and then we sit them in the chair and we haven't considered that gluteal shelf, they're obviously going to be shifting forward in the chair. The IT is not going to be in the right place, and there could be, you know, issues with the position in the lower limbs. So it's about taking into account that gluteal shelf as part of the measurement. But then to make sure the IT is in the right place, we may need to then adjust the lumbar section and remove some of that padding so that we can shift, you know, that weight into the right place in the chair.
That's the centre of balance of that person when they're sitting in the chair.
Yeah.
They tend to centre of balance is slightly further forward.
Yeah. Same with the seat width as well. If there's like, you know, extra tissue in the hip areas, then we measure seat width. There are obviously then going to be points in the chair where we can encourage things like frog legging. So we may need to then consider angling the arm supports in line to keep that alignment, to make sure we still get that proprioceptive feedback.
Our principal chair for obesity would be the Hydra Tilt, which will take us up to a 35 stone weight limit.
Yeah, one thing I would say as well to be mindful of is spinal position. So one thing that can happen, you know, with plus size individuals, that when they sit in the chair, they appear to have, you know, like an anterior tilt or an increased lumbar lordosis. And that's generally for comfort reasons, because they're opening up to relieve pressure on the abdomen. So in that case, do we really want to be correcting that spinal posture? Because we could be then causing more discomfort and more compression. So we just need to then remember that if we're accommodating, and we need to think about all the other body segments, we might need then to build up the back support to accommodate that if they're in that tilted position. So it is, I mean, in general, the rules are the same, but there are some extra things to be mindful of.
It's compromise. It's a word we use a lot of in specialist seating, and it's literally a balancing act.
Yeah, and it's ultimately down to the person how comfortable they are in the chair.
Yeah.
I hope that answers the question.
There's no yes or no.
No.
Yes, that's perfect. I think that's the only question I've got, actually. Unless anyone else has any more questions.
You're always contactable anyway if something comes afterwards.
Yeah, you know, to get in touch with us, I believe it's info@, is it, Kiwi?
Yeah, info@. I've just had another one come through. It says, would a demonstration of adjusting the seat depth be possible, please?
On which chair?
The multi-adjust advance or the Smart Seat Pro 2?
It's very similar. I'm just being pernickety.
It's quite intuitive, you know.
I'm going to take the arms off just to give you better view of what I'm doing. You don't need to take the arm off to adjust the seat depth. Seat depth we were asking.
Yeah.
See if I can get as close to the camera as I can. So there's a lever. Just see it here on the back of the chair. See that there, okay? It's very much like the mechanism that you have in your car to adjust the seat depth on your car seat. So I'm going to pull that lever down, then I'm going to push the back either away from me or towards me, depending if I need to increase or decrease the seat depth on the chair. So this lever goes down, and it'll just lock back in place. If you need to see that in a little bit more detail, we do have 2 videos on the website, and you just go in and search for it. There's a window, there's a menu there that'll take you through the various components and adjustments of the chair. So the multi-adjust and the Smart Seat Pro, the 2 chairs that I have here, basically the seat depth adjustment is the same. The hydro tilt is very similar, but because it's tilt in space only, what we're actually doing is moving the seat underneath the back. You look on this chair, I'm moving the back over the seat. Please. Because it's tilt in space only, I'm going to be moving the seat in and out underneath the back on the hydro tilt. Probably made that sound more complicated than
No,
it
it
needed.
made sense.
Anything else, Kiwi?
I think that's everything.
Brilliant. Thank you very much for
Yeah,
joining.
thanks for attending.
Yeah.
We just about finished.
Oh,
just
that
in
right
time,
on time. Look at that.
which makes a change for us. If there is anything, please do get in touch. If you'd
Yeah.
like to organise training sessions for your team, we're happy to come out to visit you across the UK. So please do get in touch. Keep an eye on our website for future webinars.
Yeah.
I'm sure we'll remind you of those anyway. It's not long now, well, a couple of months, 6 weeks before the OT show, so we'd love to see you at that as well. So come along to the stand and sing the praises of Les and Rebecca. Okay.
Thanks,
Cheerio.
everyone.
Bye-bye.
Bye.